Welcome to the GumGuru Podcast. Thank you so much for being with us. I'm Jason Kong here with Dr. Macon Singletary, and this episode is called Unlocking Smiles, Improving Oral Health for Individuals with Special Needs. And Dr. Singletary, I'm so excited for this program because I think that it's hard to find resources for those who know a family member who has special needs, or if you have a child. And I'm so excited about this program because I think it's going to be helpful for a lot of people.
Yes, I'm glad to be here, and this is an important topic. And of course, I want to wish everybody a happy Thanksgiving since it's coming up pretty soon. But we have a population of individuals out there that have compromised abilities, so I'm glad to be able to talk about it today.
Yes, and we also have a special guest here in the studio, and that is Jeff Lineberry. And Jeff is the Vice President of the North Carolina Down Syndrome Alliance. Jeff, thank you so much for taking some time to be on the show with us today.
Thank you so much for having me.
Can you tell us a little bit about yourself and your story and how you came to know Dr. Singletary?
Absolutely. So my wife and I have 3 children. Our youngest, Hannah, who is 5, just happens to have Down syndrome. And I've known Macon and his wife for years now, and I knew that they had an adult child that has Down syndrome. And so we received a prenatal diagnosis at about 12 weeks. And so one of the first people I talked to was the Singletaries. Just get some information what life looks like with Down syndrome, what we could expect for her, for our family, for her siblings. And they were just, a massive help. Gave us a lot of hope in a time that was, it was difficult for us as a family.
Yeah. And Dr. Singletary, can you tell us about your experience?
Sure. Well, we had a child early on, Laura Ann, that had Down syndrome, that had a surgical procedure and got a hospital-acquired infection and didn't survive that. And so after we had our son, we looked at what would be involved in adopting a special needs child. And it so happened September 19, 2000, a couple had a child. The dad was from Senegal and the mom was from France, and they didn't know the child had Down syndrome. And so the Amazing Grace Adoption Agency called us and said, would we be interested? And we were on a call list, and of course we said yes. And the most, thankful thing for this is that they waived the adoption fee, which is pretty much, it's just amazing what is involved in adopting children. And but anyway, we had her. She's been in our home. She's 23 now, and Jeff does our webpage, and we knew him from that. And we would be lost as Biddy in high weeds without Jeff, and his expertise is phenomenal. And he knew about Sophia, who has been with us since birth. And when he gave us a call, it's encouraging to be able to talk to somebody and tell what a blessing it is to have a special needs child. I mean, it's nothing to be afraid of. There's unknowns. What's going to happen? Will they have a normal lifespan? How to take care of them medically and orally. What to do for oral hygiene. And so we were able to help Jeff, and of course Jeff is now going to be president of the North Carolina Society, and so he's done some great things for this group of individuals. So
you mentioned the maybe different needs when it comes to oral care. What do we need to know on that front? Because this is something that I'm sure most people probably don't think about and don't consider.
Definitely, and so. I mean, it's just not Down's children. Other individuals who have traumatic accidents that affect their ability to use their hands, or they become older and have dementia or Parkinson's. So we have to gear oral hygiene to that. But the Down's individuals, the Down's children, they do have abnormal skeletal development, teeth development. They have supernumerary teeth, may not have, may be missing teeth. The cranial size may be different. So getting professional advice early on is a good thing to do, just so the teeth are able to come in a way that it can be taken care of. And then it's just a matter of to what degree the individual has manual dexterity, and we gear that for each person.
Yeah, and Jeff, I want to go back to you here because I imagine that, as you're caring for your child as a newborn, the what differences there may be in oral hygiene is probably a little bit lower down the list than, maybe not in your top 5 worries at the moment. But can you talk about learning that process and how things work when you go to see Dr. Singletary?
So, children with Down syndrome sometimes takes them a little bit longer to learn things than it would your sort of neurotypical child. One thing that we work with Hannah a lot on is how to brush her teeth. And she has a lot of actual fun doing that. But Hannah, because of some, anatomical differences, does have some tooth crowding going on. And so that's definitely something that we're going to be looking at addressing. But, one thing is with children with intellectual disabilities, sometimes they need a little bit quieter of an environment. They need a doctor that can sort of understand, some things that they can do to make the child more comfortable, to be able to sit there in the chair a little bit longer, maybe some more frequent breaks. And, that's what is unique about Dr. Singletary is that, not only is he a periodontist, but he also has a child with Down syndrome. So he understands these things much more so than, most others would.
Dr. Singletary, as you alluded to earlier, there's a wide spectrum when it comes to special needs. So what's the best way to go about visiting you and communicating those needs and seeing, how we can make a visit the most comfortable and effective way possible?
Yes, and everybody's different. So that first appointment is key because it just establishes a rapport. First of all, knowing that we care about the patient, and each person is different. Their needs are different. And what I'd like to look at is, are they susceptible? And just short appointments, like Jeff was saying, and taking breaks and talking to them and laughing with them and kidding with them. It's just not an environment that you walk in, you look at them, and you just say hey, and you dive right in. You got to communicate and be a friend. But each person ain't doing that. I'm looking at things. I'm looking at evidence that I may have from radiographs. I'm looking at their use of the hands. I'm looking at their ability to communicate. I'm looking at the medical history. And everybody is different, and I gear the needs to that. And I try to keep it as simple as possible. I had an individual come in this week that had a spinal cord injury, and I saw him come in his wheelchair, but as he was sitting, he was sitting in a normal position, but I didn't see that he could not use his hands at all. He couldn't grab. And so that's an extreme case, but that's when you got to think, okay, what can we do to help that person control bacterial growth? Because that's the key. And yes, Down syndrome, you have dementia, you have other compromised situations. The oral hygiene may be the least thing somebody's worried about, but every time you chew, you have bacteria showers of the bloodstream. So your oral health affects your systemic health. So it's a simple thing to do as long as I can see the patient and make recommendations and make it fun. An automatic brush for somebody who doesn't have real good manual dexterity can be a fun thing. Now, for my normal patients that have good manual dexterity, I may not recommend that because I like to, again, keep it simple. When I tell somebody to brush 4 times a day, lunchtime, are you going to have your automatic brush in your pocketbook or backpack or whatever? No, probably not. But yeah, we try to make the patient feel comfortable. And I'm looking at how they sit, the position. Can they use their hands? And sometimes I'll hand them the floss and say, "Show me what to do." And so I get an idea based upon my evaluation, and hopefully the patient knows our staff. And when they first come in the front door, they see a smiling face. That's the key. I mean, you can't go to a sterile environment. I don't care if you are have an IQ of 200, you walk in an office, if you got somebody at the front desk that looks like they've been sucking on persimmons all day long, you're not going to go there.
That level of comfort really does go a long way. I want to revisit something that you said earlier, and dealing with those who maybe have a dementia diagnosis or who are in the care of another person primarily. I really want to go back to the point you made on the importance of oral care and how ignoring that can lead to a host of other issues because, we all know that when caring for another individual, especially someone with special needs, it's a lot. It's a lot on you. And I think it could be very easy to say, okay, well, we can skip this exam right now, or, I got to put that off. I got to put that on the back burner right now because I've got, 5 other fires to put out. But it's going to cost you, not necessarily cost you, but it can create more problems in the long run.
It can. And there are 4 kinds of patients that I see just normally, good teeth, good gums. They just need good cleans a couple of times a year. Soft teeth, good gums. Bad gums, good teeth. Bad gums, bad teeth. That's your bless your heart group. It's the same for everybody. So even though an individual may not be susceptible to decay because they were on fluoride when they were growing up and the teeth were resistant, the bacteria grows continually. That's why trying to manipulate the bacteria 4 times a day is key, because if you start getting to grow, the early plaque growth produces an acid and causes decay. You do not want decay. I don't care how healthy you are. You don't want to have to go through fillings and crowns and root canals. And so physically manipulating that bacteria before it gets a chance to grow is key. And scrub technique, brushing just 4 times a day, just having fun. Hannah grabbing the toothbrush, and Sophia's the same way. I'll give her the toothbrush and she's sitting there brushing. Now, I'll have to instruct her a little bit, at least a couple of times a day. I go in there and help her. But there are times I say, go brush your teeth, and she'll go brush her teeth. And whether she's doing it to the degree that I would like, probably not, but she's doing something. And she likes doing it. So doing it early on, no matter who you are, it's a habit change. It's just, it's easier to tell somebody to brush 4 times a day to tell somebody to stop smoking. Nicotine's an addiction. Oral hygiene is a habit change. And no matter who you are, but you're going from being able to use the hands, being able to use an automatic brush, using a water flosser. And we have the ability, too, to help individuals with dye tablets, disclosing tablets, which is sort of fun. Let's see how good you're doing. When you get done, chew up this tablet. Be careful because it stains things. But anything red on your teeth is bacteria, sugar bugs. If you want to. You have a young individual, and so you don't want sugar bugs on your teeth. You want to get rid of those things. And when they look red, let's get that off. Let's go back after it. So we can make it fun, but also understanding that it's not just oral health, it's systemic health too. And yes, the ramifications of if you have the soft teeth syndrome, that should be identified early, and it can be. And there are things that can be done like fluoride and trays and fluoride treatment that can be done. That's prescription fluoride. They'll help these individuals, and sealants and things like that.
Jeff, 12 weeks into your wife's pregnancy, you found out that Down syndrome was something that would be involved in your life, and you sought out Dr. Singletary for some advice for those listening to this episode. And what would be your advice for anyone on just any level listening, for someone who's desperate for some advice and someone to identify with?
That as a parent, you already know everything you need to know to be able to take care of a child with Down syndrome. For maybe those things that you need some extra help with, there's groups like the North Carolina Down Syndrome Alliance out there to help. There's people like the Singletaries that are there to, talk you through it, help you see the promise in your baby, and really just, love your child. I mean, it's really that easy. Hannah she's beautiful. She's learning. She's in general education in kindergarten. She's, doing great things. And, we have a lot of hope for her future, and we think she's going to do phenomenal things with her life.
Dr. Singletary, we've visited this subject on a number of episodes, but when it comes to systemic health and Alzheimer's and the links between our mouth and our brain, I think it's not an oversight to revisit that here again.
Yes, you're right, Jason. And particularly with people with trisomy 21, they have an enzyme in the brain, superoxide dismutase, that they don't have, which prevents free radicals from forming, so they age quicker. But also they tend to have mental degeneration quicker, dementia, Alzheimer's. And so there is a link between certain bacteria in the mouth and dementia and Alzheimer's. And so again, it's really important to understand that when you chew, you have bacteria showers in the bloodstream. To be really physically manipulated, it's easy to remove bacteria and plaque. And, individuals that do have special needs children, young children, Downs children, they can call my office anytime, but, the periodontists who are geared to working with young children and young individuals, they are also very good at adapted, seeing a patient that has special needs or Downs and pointing them in the right direction, giving them the right person to help make sure the teeth come in correctly. And so between that and just making sure that physically they manipulate the bacteria consistently, make it a game. And it will help not only oral health, but systemic health too.
Excellent advice. And before we leave, we always have an action step. What would be our action step for today's episode?
Well, just, maybe grab some dye tablets. You can come by my office. You probably can find it in the pharmacy. Use those dye tablets, chew them up and swish them around, have the child do that, make it a game so they can see what's on their teeth and then begin to say, oh, I got to get that off. And, these are the bad guys. These are the sugar bugs or the bad bacteria, bad germs, But being able to make it a game, but also visualize the fact what they need to do is a good thing to do.
Jeff, I want to thank you so much for coming on the show today and sharing your story and Hannah's story. If folks want to find out more about the North Carolina Down Syndrome Alliance, what would be the best way to do that?
So they can go to our website, which is ncdsalliance.org. Our mission as an organization is to empower, connect, and support individuals with Down syndrome throughout their lifespan. We've actually got a gala coming up on February 24th, which is our inclusion gala. And so some of the things that we focus on with that is inclusion in education, inclusion in the workplace, inclusion in healthcare, and making sure that, they're making good decisions for their life and taking care of themselves. But if you go to our website and you go to the news and events area, there's a drop-down item there that says NCDSA Gala. We're looking for corporate sponsors and any individuals that would like to attend as well. It's a great time. Live music, good food, auction items, things like that.
Excellent. That website again, ncdsalliance.org. Special thanks to Jeff Lineberry for being our guest today. And on behalf of Dr. Macon Singletary, I'm Jason Kong. Thank you so much for listening to this episode of The GumGuru.
If you would like to know more about ways to make sure your smile is healthy or more information on any of the treatments in today's discussion, check out their website at northraleigh.perio.com. If you have other questions you'd like to have answered on the GumGuru podcast, send them to contact@northraleigh.perio.com.